So neuromuscular conditions are different from neurological and muscle conditions because they primarily affect either your nerve or your muscle or the junction between the two. And they manifest in different ways. So they often will affect not just the nerves and muscles in your arms and legs, they could affect muscles elsewhere, for instance, in your heart or your breathing, your swallowing. They tend not to be caused by things in your brain and spinal cord, but in the actual nerves and muscles themselves. So very different from general neurological conditions that we'd see day to day. So there are a couple of key symptoms that would make you suspect a neuromuscular disorder. For instance, weakness would be a very common symptom if you have a nerve or muscle problem. You could get cramping if there was a muscle problem, or sometimes muscle pain or fatigue, especially towards the end of the day when you've been using your muscle more. And then from a nerve point of view, conditions which affect your nerves will often cause tingling or maybe burning, numbness, sometimes pain along a certain limb. And those are the main things you would see with neuromuscular conditions. So there are a huge number of causes of neuromuscular conditions, but the commonest ones I tend to see will be autoimmune causes or inflammatory causes where your body's made antibodies, something attacking your nerves or your muscles and therefore causing your symptoms. The other big group of causes would be inherited. So we often see genetic causes of neuromuscular conditions that are passed down in families. And the other big group would probably be metabolic. So for instance, if you're diabetic, that can often cause problems with your nerves and your muscles. Or if you have B12 deficiency or some kind of nutritional deficiency, those can all cause neuromuscular conditions. So you should never ignore weakness. If you have a new onset of weakness that you've never had before, you must go and see a neurologist to investigate that. That's really important. I guess the other big sign is numbness. So if you lose complete sensation of a particular area of your body, again, you really must be seeing a neurologist. So to diagnose neuromuscular condition, the first thing is to talk to you in detail about exactly what's been going on, but also doing a detailed examination in the clinic to understand exactly what muscles and nerves might be affected. And then there are a number of investigations we can do. So usually we'll start with blood tests. So we would take bloods for instance, for nutritional deficiencies or diabetes, a number of different things depending on what symptoms you had. And then usually we'll do something called nerve conduction studies or EMG, where we're looking at how the nerves and the muscles themselves work to try and understand in what areas they're not working properly. Sometimes we would do a muscle MRI or an MRI of your brain or your spinal cord to understand exactly what's going on. And very rarely, if we're not certain about the diagnosis, we might suggest that you have something like a muscle biopsy or a nerve biopsy, but that tends to be only if we haven't found the answer from other ways.